An Italian man who has been confirmed as Nigeria's first coronavirus case after arriving from Milan was in the country for almost 2 full days before being isolated. He traveled through Lagos and visited Ogun State before he was brought back to Lagos, tested and isolated. Now, the case has prompted a scramble by authorities to try to meet and observe all who arrived on the same flight as Italian and to identify the places he visited before going to the hospital. Well, like I told you, we've been joined, joining us now to give us latest developments on this virus and how it's being contained is the Honorable Commissioner for Health right here in Lagos, Professor Akin Abayomi. Good to have you on the show this morning.
Good morning. Okay,
let's begin with this report in the papers this morning. It was quite a bit scary for me when I heard that the index case had actually attempted, to escape from the holding facility because mosquitoes, excessive heat, and poor facilities and all of that. Do you want to, set the record straight on that for us?
Yes, I saw him last at about 6 p.m. yesterday. We were explaining his condition and we were taking some new data from him. He's in an isolation room all by himself. We had moved him into that particular room because we're doing a general overhaul of the whole facility because we want to be ready. There was some discomfort in terms of a bit of heat. But by about 9 p.m., we moved him over to the renovated facility, which has lots of air conditioning, fans, and it's a 28-bed, brand new facility. And he's there on his own in this whole ward. And as of 6 a.m. this morning, I'm told he's comfortable.
But it's very troubling when hearing from you that you were trying to prepare the facility, you were trying to get ready a facility to not only take care of persons like the index case, but all other, cases that might come. Lagos State, and indeed Nigeria, had about 2 months to prepare for this. Are you saying that, what the Senate, the alarm the Senate raised as to the preparedness of Nigeria was actually true? What exactly did you have in place, before this index case appeared?
Well, I can't speak for Nigeria. I can only speak for Lagos.
Yes.
And Lagos experienced the Ebola outbreak in 2014. Ever since then, we've been building capacity because we don't want to have another such-like situation. We've been building a biosecurity unit at the Infectious Disease Hospital. That includes advanced diagnostic capacity in what we call a BSL-3 laboratory. It's the only one. We've been building our isolation capacity. Isolation wards are different from other wards. They have to have a special airflow dynamic. So we have 2 of them. As we examined them, we thought, well, okay, they were okay. We could have admitted patients, but we decided to go through a very quick renovation just to make sure that all the plumbing, air conditioning is working. We did that last week, and then we moved brand new furniture into the place. The patient came, and we just had to tweak 1 or 2 electrical installations, and then we just moved him in yesterday. So we have now ramped up our capacity to about 100 beds.
Oh, wow.
Yeah, so that is a huge amount of capacity.
And Professor Akin, let's talk about you actually meeting patient 0 without any protective gear on. Tell us about that.
Well, I didn't meet him. I was talking to him through more than 3 meters. And he is in his room, and I was standing right far off, quite a distance. I was inspecting the facilities, and he just happened to be there. And we had some exchanges. He said hello, I said hello. And the doctor that accompanies me is his physician, who sees him daily. But if I was to approach him or enter the facility, then I would have to wear full personal protective equipment.
Professor Akin Abayomi, if we take a few steps back and trace his journey into the country, we know that he traveled from Milan, already a high-risk area with a certain amount of cases of coronavirus. We know that he traveled via air into Lagos, and we know that at the Lagos International Airport there are stringent barricades or there's infrastructure there to make sure that people are able to disclose the information. There is a long form you need to fill in. You'll have your hands sanitized. You'll have your temperature taken. With all of this, still a case of coronavirus able to slip through the cracks, for lack of a better term. Do you think then that that process was rigorous enough?
Okay, so I think the issue here is the changing dynamic of this outbreak. So the focus up until, I would say, the last 2 or 3 days has been Southeast Asia, where we've been seeing the rise of cases in Korea, in Japan, Malaysia, and Singapore. And then all of a sudden, there was this new epicenter in Italy and Iran, and a few cases in England and France. So I think we had developed the form which you have to fill out. And if you're coming from what we define as a high-risk country, then you will automatically be flagged, and our team will put you on what we call supervised self-quarantine, which means you go home, you stay at home for 14 days. We call you every day, twice a day. We sometimes visit you if there are issues. And then after 14 days, if nothing has developed, you're free to move around. But he came in, he filled out the form actually, and he did state that his point of origin was Italy, passed through Istanbul and came to Lagos. We had the form, but I think, you know, there's so much going on that people didn't realize that Italy had now joined the League of High-Risk Nations.
Is that worrying to you that they weren't aware? Because we were aware.
Yes, well, it is a bit worrying, you know, and the airport is a federal authority, and the state is giving the federal authority support by deploying 60 of our healthcare professionals just to make sure that this kind of thing doesn't happen. So now we've put Italy right up front. I mean, it's clear, and Iran and other places like that. So I think it's important for us in Africa and for the rest of the world to recognize that this virus is in many more places than Southeast Asia, and that we need to have a much higher index of suspicion for people coming from these new epicenters, and in fact, you know, from anywhere in the world, because air travel is so dynamic.
Absolutely. I just wanted to take us back to what you were saying, and that is the timeline of events with patient zero. So you'd gotten up to him incubating himself for 14 days or self-quarantine. What happened after that?
Which patient is this?
This is the patient from Milan.
Well, he didn't know. He has no recollection of contact with anybody who was unwell. He came in to Lagos on Monday evening. He spent a night in a hotel. On Tuesday morning, he proceeded to Ogun State, carried out his business. On Wednesday afternoon, he fell ill. He was seen by the company doctors, and they recognized his point of origin and thought it was probably suspicious. There's no chance that he had malaria. He'd only been in the country 2 days. So they called us because they don't have a testing center in Ogun State. So we also recognized that this was a high-risk situation, and we advised that he be brought to us immediately under full protection. As soon as he arrived, we put him into our isolation unit, and we conducted the tests. And within hours, the test signal came up positive.
Now, in the United States, we have the first case of a community spread. Do you think that with patient zero, as we call him, with him actually coming into Lagos and into Ogun State as well, into 2 states in Nigeria, that this now puts us at risk of community-based spread?
Yeah, so I mean, this is how the outbreak starts. You know, someone comes in, the idea is to break that transmission. You know, and that's what's called line listing or contact tracing, you know. So we need to find at every point who he's been in touch with and try and identify that person and isolate them so that if they do develop symptoms, we're on it. It's not that you develop symptoms and then you start spreading the virus to people in your day-to-day activity. So that's the whole idea of confining you in your home and monitoring you on a daily basis. If you develop any of the symptoms, then we're there. And then we can take you in straight to our facility and then conduct the tests there.
And could we just, sorry to interrupt, could we just briefly recap those symptoms for the viewers at home that may or may not be aware?
Well, typically they talk about fever, plus or minus respiratory symptoms, a cough, a sore throat, a runny nose, body ache, and difficulty breathing. But in this case, he only had fever and body pains. There were no, and up till this morning, he still does not have respiratory symptoms, which is a good thing for us, because that suggests to me that he's probably not as contagious, because it's through coughing and sneezing that you aerosolize the virus, and it goes on your hands and on things around you. If he doesn't have that, the virus remains confined in his body. It's in his saliva. So unless he's, getting saliva on you, which is unlikely, then you're not, it reduces the chance of transmission.
Okay, now that we have this case on our hands, and the other 120 passengers on that Turkish airline, where are we now in terms of surveillance, tracking, and what have you come up with, that can give Nigerians confidence not to go into panic mode?
Yes. So we've got the manifest of the flight. We also have all the forms that the passengers filled out. So as we're speaking, we're identifying the whole airline passenger crew, passengers, and we're going to we started to contact them one by one. And the other point is the hotel in Ikeja. So we've been there. We've started to identify who are those people. This happened on Monday night, remember. It's Saturday morning. We've already started. Yes, we've started to identify. He got sick on Wednesday and he was diagnosed on Thursday. So we've had Friday and today to do some work on that. So we've been there. We've identified the possible contact points with him, identified his room. This morning we're going there to decontaminate the whole hotel, inside and outside. And then obviously the people who have been in touch with him or anybody who has used his room in the last 3 days will be identified, and they will come under surveillance.
But are you looking at more proactive ways like South Korea has done? I mean, it's another place where the situation is really dire. The spraying streets and all of that. And I'm thinking, Mile 12 market, for example, Mile 2, all the major markets in Lagos, Oyigbo and all the rest of them, where people just really step on each other. What are the proactive measures that you're putting in place to take this beyond the isolation centers, and the facilities that you have in Lagos?
Well, it's impossible to decontaminate a city. You just have to practice what we call infection prevention control. If we start to see person-to-person spread in Lagos, then we will kick into another mode, which is to try and cut down on crowded places, to enhance personal hygiene, which we're already doing. But just remember, coronavirus is like any other virus. It's like a cold or a flu. You can't, if there's a flu outbreak, we don't go around spraying the whole city. People will catch it, people will get sick, most people will survive. Very few will succumb or die from the infection. So the good thing about this virus is that its kill rate is extremely low, much lower than flu or the other SARS or MERS or Ebola. So that's the good news and the reassuring thing. The chances of you catching it depends on, one, the epidemiology of it in your city or the outbreak dynamics. Yes, Lagos is very crowded, so that's why we're worried. But we are exercising what we call biothreat reduction, which means intercepting people at the airport. If people slip through the nets, then we intercept all their contacts. So what we're doing really is to stop the opportunity for this virus to get into the community at large. So break its cycle of transmission as the first case. Now, if we can't do that, then we're ready for a small outbreak, as most countries. And that's why we're ramping up to 100-bed capacity and more. If it overwhelms our 100 beds, we have 5 big general hospitals, and then we have 2 IDP camps, each holding about 1,000 people. So we'll automatically go from the infectious disease facility to our general hospitals and then to our camps. So we have possibly about 2,000 bed capacity in Lagos, which is a huge number by any stretch of the imagination. And then, if it goes beyond that, then we have to kick into what we call community-based management, where we manage people in community, and then we only bring in to our hospitals the complications.
Well, Professor Abayomi, I would just like to commend your efforts and that of Lagos State, because not only has the WHO said that Nigeria is adequately prepared to combat coronavirus, but there was a lot of furor over the fact that patient zero arrived into Lagos on Monday, and we weren't told about it until Thursday, but you have successfully debunked that rumour in order to tell us that actually his symptoms didn't start to show until Thursday, and you let the general public know that very morning. So I would just like to commend your efforts, because clearly we are adequately prepared.
Well, I'd like to further that point. I know you mentioned there, Professor Abayomi, the need to break the cycle so that we can avoid community-based spreading of this virus. I know you touched earlier on the patient zero's geographical movements within Nigeria. You said that he left the state into Ogun State. Yesterday evening, Governor Abiodun said that they had identified at least 28 people who had been in contact with patient zero. Are you confident in that number?
Yes, I'm in daily contact with Ogun State officials, the commissioner, the factory that he was working in. We've identified all the close contacts. They've more or less put all those cases under supervised isolation. They're giving me the data every day. But every state is working independently under the supervision of the Nigerian Center for Disease Control and the Federal Ministry of Health. So we're all in contact, and it's important. You see, that relationship between Ogun State and Lagos was so important. This was almost like a sting operation. You know, they reached out to us, and we clearly understood the threat. And within 4 hours, the situation was brought under control. I think that's a remarkable achievement.
It's wonderful.
And I'm wondering in terms of specific training for the health workers, because they are at the forefront of this. And every time there's a major outbreak like this, especially one that people are not really too familiar with, they are the ones to first go down. What measures are you putting in place to protect the health workers who will be directly involved in treating the coronavirus cases?
Yes, this is a very, very, very important issue. You know, the frontline workers, we have to protect at all costs. You know, we also have to give them the confidence to do their job, which means we have to equip them and equip the environment. It's no point asking any of our healthcare professionals to go into the battlefield without ammunition. So we're putting them through a lot of training, we're ordering all the necessary equipment, and we're preparing the environment for them to working. I mean, Lagos State has a very sophisticated biosecurity facility. I think it's second to none on the continent. And it's because we experienced Ebola. And, once you've experienced something like that, you don't want to live to tell that kind of story again. So we've learned a lot of lessons from Ebola, and we certainly have put every effort to raise the standard of care in Africa by demonstrating that we can do it. And we've had international collaborators. We have a sophisticated facility, and we've put a lot of professionals under what we call biosecurity training for the past 3 years. And we have a crack team now that is on ground, ready to address this situation.
And at this point, it would be nice to bring in the WHO representative, Mr. Clemens Peters. And maybe even before I bring him in, exactly what support are you getting from the WHO? Because they have stressed the fact that they will be supporting Lagos State and indeed Nigeria. Are they, living up to expectations so far?
Oh, yeah. I mean, we have a Lagos representative. He's almost in my ministry regularly. He's involved in what we call the Emergency Operation Command. When we launched the Incident Command System with Mr. Governor Babajide Sanwo-Olu, he was there, advising all along. And, we're just, there's just a great collaboration between Mr. Governor, the ministry, the WHO, Nigerian Center for Disease Control, the Minister of Health. So everybody is working hand in hand. It's not a matter of Lagos, it's a matter of Nigeria. And if there's an outbreak, people sometimes say, well, why did you bring the patient from Ogun State to Lagos? Well, Ogun State doesn't have a testing facility. We needed to test fast. We needed to protect Nigeria. If there was an outbreak in Ogun State, it was surely going to affect Lagos. So it was in our interest to come to the assistance of Ogun State and bring this index case under control very quickly. And Mr. Governor was informed almost every 5 minutes of the dynamics of the sting operation.
Well, let's bring in Dr. Clement Peters, because I'd like to know, you represent Lagos State, and as we know, we're doing wonderfully in terms of combating this scourge, but are we ignoring the other states, the other 35 states in Lagos, in Nigeria rather, at the expense of Lagos? So let's bring in Dr. Clement Peters in order to better answer that question. Dr. Clement, are you with us?
First, let me thank the Honourable Commissioner for eloquently updating the Nigerian people about the situation, and which they are managing very, very well. Nigeria, in terms of the response to this coronavirus, you know, what the Nigeria Center for Disease Control, working with all the partners, try to really map the country in terms of priorities. The states which are quite, perhaps we consider them more important, 5 states with large volume of people traveling outside the country to China or other countries which are already affected. These are considered the priority countries, states. Now, in these states, there must be that capacity to be able to detect and then respond immediately. That means the laboratory is important. That means the isolation facility is very important. It means also the surveillance aspect is very important. The ports of entrance are strengthened. So this is very important. And it means not only focusing on Lagos alone, but focusing on those priority states. And then in other states, there must be the element also of ensuring that surveillance works, because if someone comes across any of the ports of entry and goes to any of the states, that person needs to be followed up. So start with the priority states, make sure that there's some capacity, but nevertheless, the preparedness involves the whole country.
Well, Dr. Clement Peters, I would like to talk to you about the international risk that is still very much happening. We can be assured here in Lagos and in Nigeria that there is the right authorities are in control, or at least trying to be in control of this outbreak. Before we came in, we heard stories of Oregon and California experiencing new cases, again, as Keturah mentioned, to do with community outbreak and community spreading amongst people. Can you tell us more about that and whether or not people should be worried adequately, because now it's not an instance of travel being the primary cause of the spread. It's definitely, we're seeing examples of it happening within communities.
First of all, we should not get panic, or we should not panic when we hear things happen in other countries. What is very important is that are all the Nigerians informed about this disease? Do they know about this disease? Do all the Nigerians know how to prevent themselves against this disease? Is the government investing enough, and all the partners, to be able to detect and control should we have a case? I think those are the fundamental things that everyone should know and every country should have. So it is important, and as the Honourable Commissioner said, the most important thing is we get these cases, rigorously make sure that they are contained, and then the situation becomes under control for everyone's welfare. When we reach to this community level, it means things have moved from where we should have control quickly to more community care, which is a different dimension. But I think what is important for Nigeria today is that we need to take all the preventive measures. The assurance that the government is investing a lot and making sure that should the country have any case, it is treated immediately. And it is important that we all practice the preventive measures. So those are really fundamental. Let's have 3 or 4 key messages that the communities will have. We all have the same level of understanding.
Let you go, Mr. Clements. Let's talk about where we are in terms of research, in terms of solution to this outbreak. We do hear that about 20 COVID-19 vaccines are available now, or being developed worldwide. What can you tell us about how close we are or not to a solution?
Thank you. The fact that this is, of course, a new virus, we need to get vaccines for it, we need to get treatment for it. And a lot of work is happening globally to accelerate the process of getting vaccines and the treatment. On the routine basis, when WHO provides guidance to development of vaccine, normally takes a long process. But with this emergency, this process can be accelerated to a very short time. I'm sure you heard in the media, many countries are thinking close to maybe 4 or 6 months, there should be some vaccines. Others may be below that. But what WHO is coordinating, ensuring that with all these research institutions, let's have vaccines as quickly as possible.
Okay, thank you so much, Dr. Clemens Peters, WHO representative here in Nigeria, for enlightening us further on this outbreak. We hope there will be a pushback sooner than later. We still have the Commissioner for Health right here in Lagos, Mr. Akin Abayomi. We did hear from the Lagos State Governor, Babajide Sanwo-Olu, that it has not gotten to the point yet where we'll begin to put, some kind of ban or, closing the borders and all of that. How bad does it have to get, for that measure to be put in place?
Well, I think we don't want to suffer a double impact from this outbreak. We want to be able to put all our healthcare institutions on fast track. We don't want to dampen our economy. People start suffering from loss of livelihood. And that's the whole point of when the WHO declares a public health emergency of international concern. Really, it's to do two things. It's to ramp up public health response mechanisms, but also to safeguard trading routes. And we've heard all along the past week how the stock markets are collapsing. So now we've got a double outbreak. We've got a virus outbreak and we've got an economic collapse looming on us. I mean, that's just not really what we want. So we want to protect the trading routes, but at the same time ensure that we have everything in place to deal with micro outbreaks and contain them fast enough. If it gets out of hand and it's a global epidemic, then everybody's in the same boat. But then at the same time, you still have to earn a living, and you still have to trade. You still have to eat. We don't want people going into periods of food scarcity and lack of necessary social services. So these are the important things that we must pay attention to. And as I said, it's like a common cold, or a flu. So we don't need to break the global economy because of a common flu. We just need to have our facilities jacked up. And I think it's just a warning sign to all countries in the low to middle income countries that we need to pay attention to public health infrastructure. And this government in Lagos State is prioritizing health through Governor Babajide Sanwo-Olu. He's put us on the top notch of the priorities to strengthen our primary healthcare structure, which is where we would pick up these cases, which enhances our surveillance mechanisms.
Now, Professor Abayomi, I'm glad that you mentioned the flu, because actually the common cold has more fatalities globally than the coronavirus COVID-19. But in terms of COVID-19 and focusing on that, because we've seen countries like the US, like the UK, like Italy even, whereby there are lots of fatalities in relation to those that are affected. What are the next steps for Lagos State? Let's focus locally. If this does become, let's look at the worst case scenario, if this does become a community-based spread, because it is looked at now as a global pandemic as opposed to an epidemic, what are the next steps for us? What do we do?
Well, the next steps are to ramp up our capacity to manage it in community and confine the hospitals and our treatment facilities, our biosecurity unit, to complicated cases. So then we just need to have a lot more community-based management. So all our, our social workers, our community nurses, our community doctors, our primary health care. And that's the emphasis of strengthening primary health care, which is what we've put on our priority list to make sure that our PHC level, which is the base of the pyramid, which is where most people go, that's where we collect our intelligence. And Lagos has an incredible community-based intelligence. I can find a needle in a haystack in Lagos because of this very unique social connectivity that we have. I think it's just a factor of Nigeria, but we're maximizing it in Lagos. I can find anybody. All I need to do is put out the community intelligence, and they'll pick up whatever we want. And so that's very reassuring for us.
If we talk, it is, isn't it?
It's very reassuring.
It is. It is. If we talk about the way we're using medicine to treat colds and definitely coronavirus, we heard Dr. Clement Peters there say that there's a delay, perhaps 4 to 6 months in terms of a vaccine. But in terms of Nigeria, in terms of Lagos, what are we doing, or what needs to be done medically in terms of servicing drugs to make sure that there is?
Are we producing them locally even?
Yeah, so that's what we call medical countermeasure. So there are a number of countermeasures. First of all, the most important thing is supportive care. Then we look at vaccine development. Normally it takes 3, 4, 5 years to develop a vaccine, so we make sure it's safe. But under these kind of circumstances, we fast track it so that you can get a vaccine on the market in about 4 to 6 months. That's a record. However, we still don't know what the long-term implications of that vaccine are. There could be side effects down the line. So we always treat these kinds of fast-track medications or vaccines with caution. Then there are the trial drugs. For viruses, generally, we don't have much in terms of medical armamentarium to treat viruses. It's not like bacteria where we have antibiotics. Viruses, apart from HIV, we generally don't have any specific treatment for viruses, like the common cold. Up till today, there isn't a treatment for the common cold. But there are some candidate drugs that we've identified that may have an effect on COVID-19. Again, we need to put them through trials. So what might that do? It won't cure it, but it might just take the edge of the infection and make sure you don't go from sick to severely ill, requiring ventilation or kidney dialysis or something like that. So we're just trying to shorten the natural history of the infection and make sure that you have a relatively smooth process during your infection. So now we know that corona, like any other virus, can affect you, and it's an interaction between the genetics of the virus and the genetics of the human being. And everybody's different, as you know. So all 3 of you can catch corona. One of you may not even know you had it. One of you may know that you're quite sick, and the other one may be very sick and may even die. So that's the relationship between pathogens in the environment and us as human beings. It's a genetic game. So we know that many people are catching corona and don't even know they caught it. You might have a little sniffle, a headache, a few hours, and it's passed. But you might be excreting it. Some people will get sick and need to be confined, and other people would be quite sick. So that's the spectrum of disease profile that most viruses demonstrate, just like Ebola. We found out after Ebola that people caught Ebola and never even knew they caught Ebola. And that's just the beauty of the immune system and the strength of your genetics. Some people are susceptible, and some people
are just not.
It's
interesting you even talk about that. Maybe we should, use this opportunity to bust some myths out there, some information or misinformation, if you like. A lot of people saying, oh, chloroquine is good, in treating COVID-19. Even the HIV, ARV drugs are good and all of that. And you just mentioned HIV. Help us understand, educate the viewer as what really they need to do in the event that they come down with any suspicious symptoms in order not to, go self-medicating, like, unfortunately, we are used to doing in this part of the world.
Well, the important thing is that you contact our helplines. We will take a good history. We will identify your risk. If we feel that there is a high risk that you fit the case definition, then we will move you or we will send help. It's important that you don't self-medicate. You can take simple things like paracetamol that just dampens your fever, but don't try and use antibiotics. That's even illegal. You shouldn't be able to gain access to antibiotics or any other prescription medication without a doctor's consultation. It's important we know, and if we know, we respond. And for now, there is no definitive treatment for coronavirus. But then again, the other aspect to it is the research countermeasure. So when you have an epidemic or an outbreak from an unknown pathogen, which is what WHO call Agent X. So this Agent X was unknown for a few weeks, and then it was identified as corona. So it was Agent X for about 2 or 3 weeks. Then the science kicked in, identified its strain. It's one of the coronaviruses, of which there are thousands and thousands, and there are many in Africa, by the way. Oh, yes.
Yes, that's why it's called the novel coronavirus.
That's why
it's a new one.
So we are infected by coronavirus all the time. A common cold, it causes the cold. It's one of the cold viruses. But there are thousands of them, and there are thousands of them in the wild as well, which is why it's so important that we respect the wild. You don't go around hunting and bringing in wildlife. All these animals in the wild are carrying thousands and thousands of unknown viruses. Yes, the hunters may have immunity, but you as a city dweller, you've not been exposed to this. So we're really, discouraging hunting of wildlife and excursion into the wild without due precaution. Because bats, for example, are known to carry more than 5,000 different strains of coronavirus. And yet people hunt bats and eat them. Rodents carry all kinds of viruses, including Lassa fever. And children play with rats. That's how the Ebola outbreak started in Guinea. A child was playing with a bat, and a virus, infected the child, and it caused the economic collapse of a region. So that's the significance. And this virus, it's causing a global economic collapse.
About $6 trillion already wiped out.
Exactly, and we're just starting.
Absolutely.
So this is the significance of the intersect between human beings and the environment. These are what we call zoonotic infections. They come from animals, the zoo. So you have to respect the wild, and if you mistreat the wild will mistreat you.
I like that.
I like that.
And it's interesting because, like you said, it's a zoonotic disease, and that's how it started from I think it was a wild animal market in the Hubei province of Wuhan. But let's talk about the Italian, because you mentioned that he is getting better. Is this as a result of him being in the tropics, if you will? Because there's been a lot of talk about the climate out here. You sweating out the fever, perhaps. Is that one of the reasons why he's getting better?
There's no evidence whatsoever. We just do not know enough about this virus. Coronaviruses survive here, so why not this one? Yes, people get more flu-like infections in cold climates. That's because they're all huddled up and, they're in crowded conditions and they don't open their windows because they want to keep their rooms warm. But I don't think that it's a factor of the virus itself. The virus will look for any opportunity, and its mission is to propagate itself, and it's looking for new victims all the time. So I don't think that he's getting better because of the environment. I just think, as I said, it's a game between the virus and his genetics, and he's not particularly ill. But we have to keep him in confinement, even if he's feeling better, until our tests show that he's no longer excreting the virus, which means he's no longer contagious. Because you can be fine, asymptomatic, and be contagious.
Right. Of course. And just to piggyback off that, because we know that this disease has spread rapidly in places like the US, like Italy, yet we only have 3 cases on the continent. You've got one in Nigeria, in Italian, you've got one in Egypt, and you've got one in Algeria. Yeah. Yet none of these people are melanated. So is there any link whatsoever? Is this a myth as to being a highly melanated person not contracting it as easily as a Caucasoid, perhaps?
Right. This is why we need to do the research. And we're not doing by far enough research in Africa. We're just relying on research that's done in developed countries. Our governments really need to set funds aside for our local scientists to do local research. You cannot take research done in UK or China or America and transpose it to Africa. America and China spend billions of dollars on research, and that's why they are where they are. So we need to investigate what's going on in our environment. If there is indeed some kind of environmental resistance to this virus, maybe because of the thousands of coronaviruses we have in our environment, which gives us immunity to the family of coronaviruses, which means that perhaps there's some cross-immunity working here. Then, you know, we all grow up in a tropical environment where we're exposed, you know, more than most other countries to a lot of pathogens. You know, we eat out on the street. We eat things roasted on the side of the road. We go to what's called bukas and things like that, you know, where there's poor sanitation. We're exposed to pathogens all the time. You know, so it's possible that we have immunity. It's possible our genetics, again, is not accommodating to this particular strain of coronavirus. Or it may just be a matter of time and mathematics.
And when you say it may just be a matter of time, maybe that's exactly what has happened with the index case that we, you know, that came into Nigeria. But let's even talk about that funding issue that you talk about and the need, you know, to be at the forefront of research on ailments that actually directly affect us or even don't directly affect us. How much, I mean, the federal government, we heard about last week, earmarked about 600 million naira to push back the COVID-19. And we heard from the Science and Tech Minister that they will give 35 million naira to whoever comes up with a solution to Lassa fever and coronavirus. Speak more about the need, you know, for us to actually do research and depend on ourselves to find solutions to our, you know, ailments.
Well, what you've spoken about mainly refers to building medical capacity. It doesn't speak to research. They're two different things.
Entirely.
Building a hospital and training doctors and buying medicines and PPE is just response capacity. We need medical intelligence. We need the ability to predict. We need the ability to respond to an outbreak with research. If it's an unknown pathogen, nothing's going to work because you don't know what it is. You've never seen it before. You know, so your research has to kick in almost at the same time as your medical countermeasure. So talking about millions of naira, even if you spend 360 million naira, that's $1 million. America spends...
It's nothing in the grand scheme of things.
Spends, you know, millions of dollars on one research unit in one university all over Africa, you know.
We'll have to leave it there. Professor Akin Abayomi, Commissioner for Health, right here in Lagos. It's been nice talking with you. And we hope the next time we see you, we'll have something positive.
Well, we'll be looking for daily updates, not just on social media. We'll be looking for daily updates on Arise News.
Well, social media is powerful, so go to my handles, Prof. Akin Abayomi, and follow what's happening on a day-to-day basis.
Fantastic.
Thank you very much.
Sure will.
Thank you.